If writing therapy notes feels like the second full-time job no one warned you about, this video is for you. Today, I want to show you how to write clinical therapy notes that are high quality, time-saving and compliant without overthinking every sentence and without carrying documentation stress into the rest of your day. One of the biggest mistakes therapists make is thinking a good note has to be long. It does not. A good clinical note is not a transcript of the session. It is not every detail the client shared. And it is definitely not a place to prove how thoughtful you were by writing a novel. A good therapy note does three things. It shows why the session happened, what clinically important material came up, and what happened next in treatment. That's it. So here is the simplest framework I recommend. Think of every note in 4 parts: presentation, intervention, response, and plan. Presentation is what the client came in with. What symptoms, stresses, behaviours or functional issues mattered today. Keep it focused and relevant. Intervention is what you actually did as the therapist. Did you use CBT techniques, reflective listening, psychoeducation, cognitive restructuring, trauma-informed grounding? Name the intervention clearly. Response is how the client engaged. Did they participate actively, show insight, struggle to apply the skill, demonstrate progress? This is the part many clinicians skip, but it matters because it connects your work to the client's clinical presentation. And then plan. What happens next? Continue weekly therapy, practice a coping skill between sessions, monitor anxiety symptoms, follow up on family conflict next visit. If you cover those 4 things, your note is already stronger than most overly long notes. Here is the second tip. Write clinically, not creatively. Instead of writing, "Client had a really hard week and seemed very overwhelmed by life," write, "Client reported increased anxiety related to work stress and difficulty sleeping 4 out of the past 7 nights." Notice the difference. It is clearer, more defensible, and easier to justify later if the chart is ever reviewed. Third tip, do not put everything in the note. Your note should include what is necessary for continuity of care, medical necessity, and a clear picture of treatment progress. It does not need every example, every quote, or every emotional nuance from the session. That is where therapists lose time. They confuse completeness with usefulness. And finally, make your notes easier by using repeatable structure. Whether you prefer SOAP notes, DAP notes, or another therapy documentation format, the best system is the one you can use consistently and quickly. Structured documentation formats are commonly used because they make notes clearer and easier to standardise across sessions. So if you want your notes to be faster, better, and less stressful, remember this. Do not write everything. Write what matters clinically. Use a structure. Name the intervention. Show the client response. End with a plan. That is how you write therapy progress notes that protect your time and reduce audit anxiety. In the next video, I'll break down the biggest therapy note mistakes that make notes weaker, riskier, and more time-consuming than they need to be.